Hello everyone, welcome to my YouTube channel. I'm Babita. If you are here, you are probably getting ready for your NCLEX exam, and I am here to help you with the tips, strategies, and notes. In today's video, we are going to go over some essential infection control practice that you will definitely see on your NCLEX exam question. So let's start. As we all know, healthcare workers should practice infection control to prevent the spread of infection in healthcare setting. In today's video, we will be discussing in details on standard precaution and transmission-based precaution. Standard precaution are the basic infection control practice used to prevent the transmission of infection in healthcare setting. They are applied to all patients regardless of diagnosis and include the following: hand washing, gloves, alcohol based hand rubs, mask, eye protection or face shields, gowns. Similarly, transmission based precautions are the additional precautions used when a patient is known or suspected to have a specific infection. We will be discussing in details about them. It include airborne precautions, droplet precautions, and contact precautions. First, airborne precautions. The disease include measles, tuberculosis, chickenpox, varicella virus, disseminated varicella zoster virus, smallpox, SARS-CoV-2, COVID-19. Here is a mnemonic to make it easier to remember. MTV sings songs. Sings MTV is a channel where we enjoy songs, so we can use it as a fun way to help remember airborne disease more easily. For the protection, N95 mask by the health worker, surgical mask for client during transport, negative pressure, HEPA filter, private room, door closed for the patient, hand hygiene with soap and water, gown and gloves if potential contact with body fluids. Now let's see the droplet precautions. It is followed to prevent spread of infectious droplets when the patient coughs, sneezes, or talks. We have a bunch of disease and droplet precautions. They are scarlet fever, pertussis, influenza, diphtheria, epiglottitis, rubella, sepsis, Haemophilus influenza B, adenovirus, RSV, mumps, pneumonia, COVID-19, rhinovirus, bacterial meningitis, parvovirus B19, streptococcal pharyngitis. So, to remember these all the disease, I have made a mnemonics: spiders harm new crabs to make recalling the information easier. Hope you guys will enjoy. Likewise, for the protection from droplet infections, private room or cohort client, like the client should be kept alone in a single room. Surgical mask should be worn by the healthcare worker within 3 feet of patient. Mask for client during transfer, goggles, along with droplet precaution, additional contact precaution for RSV. Unlicensed personnel should wear mask. So the last one is contact precaution. It is used for disease that can spread through physical touch or contaminated surface. The focus is on preventing contact with body fluids or contaminated surface. The disease are conjunctivitis, RSV, adenovirus, MRSA, poliomyelitis, human metapneumovirus, influenza, VRE. I have created this mnemonics, which is cramp HIV, so that it will be easier to remember. Along with cramp HIV, we have some more. They are contact enteric, C. difficile, norovirus, rotavirus, and in skin infections such as cutaneous diphtheria, herpes simplex, impetigo, pediculosis, scabies, varicella zoster, and some own infections. For the protection, Contact precautions, PPE plus hand hygiene with soap and water. No alcohol hand rub alone for contact enteric because in case of contact enteric, the spores are resistant with the alcohol. So we should always do hand hygiene with soap and water. And for RSV, along with contact precaution, there is also the infection precaution. And the others are hand hygiene, the dedicated equipment for the patient, single room for the patient, gown, and gloves. Remember, all three types of isolation precaution are applied for SARS-CoV COVID-19, droplet and contact precautions for RSV, influenza, and adenovirus. Because, in addition to being transmitted by respiratory droplets, they can also spread via contaminated surface. And always contact precaution PPE plus soap and water for contact enteric like norovirus, C. difficile, and rotavirus. So at the end, let's see donning PPE and doffing PPE. It's I have tried to make it easy to remember. Doffing PPE is in alphabetical order, and donning PPE is from down to up, and then gloves like down first gown, mask, goggle, and then gloves. While donning and while doffing, gloves, goggles, gown, and mask. Remember that hand hygiene is mandatory before donning and after doffing PP to ensure safety and prevent contamination. That's all for today on infection control. Thank you for watching. And remember, infection control is everyone's responsibility. Stay safe and keep practicing good hygiene. Once again, thank you for watching.